Reenita Das, Transformation Health Partner and Senior Vice President of Hospital Sullivan.
Hey everyone, it's great to be here in Dubai. I will be honest with you that this is really my second visit. My first visit was at Arab Health, but this is my second visit. So I'm learning a lot every single day about this country, the culture, and the amazing food and people here. I live and work in Silicon Valley in California. I'm surrounded by Google, Amazon, and Facebook every single day, and I hear about how they're going to change the world of healthcare, which made me start to think about what is that new space that we're going to be talking about. And today, for the next 20 to 30 minutes, I'd like to spend a few minutes to try and share that vision with you of how healthcare will be redefined and transformed, largely because of the impetus of healthcare information technology, and what that really means to providers, payers, and stakeholders in the world. So I'll talk about some of the broad trends that are driving this change from a global perspective. I'll also then go into two areas that I feel will have phenomenal impact in healthcare. The first area is what we call artificial intelligence, which some of my fellow speakers have talked about already, and then I'll talk about the Internet of Medical Things. Today we're going to be living in a world largely which is going to make healthcare invisible. The way healthcare has been practiced for the last 200 years has really not been on healthcare, it's been on sick care. And the way hospitals have got their money has been based on keeping patients inside the hospital as long as possible. And now those dynamics have changed tremendously. The very measures that where money was being made are being cut, and now the new measures are you need to keep people well at home longer and longer. And that has put a lot of stress on the system, and I believe in a lot of ways digitizing healthcare will help to alleviate the stress and really help doctors to focus on why they went to medical school. I study a lot of doctors and work with them across the world. I also advise at Stanford University, which is very close to where I live and work. And one of the biggest things I notice with doctors are that 80% of their time they're faced with administrative burden. They have so many paperwork to fill, claims to fill, insurance issues to do, tests to look at. And I think this is one of the great ways that healthcare IT will help to alleviate that, so that they can bring the empathy and the compassion back to why these wonderful people went to medical school. So I'll talk a little bit of that as well. So what are some of the shifting factors that are driving change? If you look at the bar graph on the side, you'll be able to see that so far we are following what we call the 80-20 rule. And what the 80-20 rule means is that 80% of the people 20% of people are being serviced by 80% of cost. So the 20% of people are the really, really very sick people, and 80% of healthcare cost is going to service them, which is really an uneven equilibrium to be able to have any business that's sustainable in the long term. And so what we are trying to do is really to shift the impetus and the focus from people who are sick to keeping people well, and really trying to manage the dollars and move the dollars from managing chronic diseases or end of life to really move them to keeping people well and people who are at risk. And I think this is where the whole aspect of prevention and wellness comes in. So one of the big things I do at Frost & Sullivan is to look at the big mega trends that are happening. And I think health and wellness is one of the biggest mega trends that go across every single industry. If you're an automotive company working in automotive, today we're working with car companies to build healthy cars and create an environment of health and wellness in them. So every industry is impacted by healthcare in a way. It's one of the largest industries in the world. In fact, it is the largest industry in the world. And yet, we're spending so much of our time and money, instead of focusing on health, we're focusing on sick care. And I think that balance of power needs to move. So with the focus now on health and wellness, where the awakening is now on prevention and rather than on treatment, where is the future opportunities going to lie? So the right side, which is where you look at three timelines, 2007, 2012, and 2025, I did this experiment to look at where revenues currently are being spent globally. So if you look at the blue in the center, 70% of revenues are focused on treatment. That is on drugs and devices that are given to people to help to cure them, hopefully. And the rest of the money is spent on diagnosis, which is very, very little, which you can see in the green, and almost very little on monitoring and nothing on prevention. Isn't that a weird system that we're spending all our money when someone is seriously ill and no money at all on the aspects of how to diagnose them well? So today, if you are in pharmaceuticals only looking at building drugs, or you're in medtech only looking at building devices, very soon your market would have been taken over by monitoring, diagnostics, or prevention. Because these are the markets where the growth opportunities are. And that is why Big Pharma is in such a mess, if I can use that word, simply because they have not focused on anything else except drugs, which you're addicted to by the end of your life and you keep having over and over and over again. And so that is why now many pharma companies are building the strategy of what we call digital therapeutics that will help them to make that transition. So what are some of the big trends that are driving the healthcare transformation scenario? I want you all to think of what the financial services industry looked like around the year 1999 or the year 2000. We had to wait to go to a bank at a particular time to take out money or to make a bank transaction. We had to, we had to see someone physically and build a relationship with them, and then based on that, we did our financial transactions. Now, 18 years henceforth, the whole financial services industry has transformed itself. Now I can take out money from my teller at 2 a.m. in the morning. I can make transactions on my cell phone. So if you actually think of healthcare, healthcare will follow exactly the same pattern as the financial services industry. And we've done a lot of work looking at the correlations between the two industries. After all, healthcare is a service industry, but it is the only industry in the world that when you buy a service, you don't know what the outcome is. You don't know if you're going to live, you don't know if you're going to die, or if you're going to get 3 more other diseases. So this is what we are asking these serious questions today as to why we have never thought of this industry as a service industry, in a sense where we are buying a product and yet we don't know what we're going to do with it. So that is where the whole healthcare consumerization has come in. And I think companies like Google, Apple, and Facebook have really looked at healthcare now in a very different lens to many of us who have worked inside the industry for all these years. They are looking at it no different than any other consumer industry. The other big thing that has come into healthcare is that it's really based on predictive and prescription medicine, and that is what the whole aspect of precision medicine is. In a very simple way, precision medicine means bringing the right product to the right person at the right time to the right channel. Very simple, right? We learned this in Marketing 101 class for any consumer product. But today we've made it a very fancy name called precision medicine, and we're trying to adopt it to healthcare. So it just shows that we have really not been adopting any of the core values of consumer behavior and consumer relations into healthcare, which is now we're talking about it. We're only talking about it because we're in the corner in terms of money. 17 to 18% of GDP, $17 trillion. It's scary. So this is another very big thing that we're seeing. The other big thing that we'll see is the whole concept of anytime, any place care, continuous care. All our decisions on our health and our life are taken in one consultation with a physician that we have for 30 minutes over the course of every 6 months. And from that one consultation, We are taking major decisions on how we will live, work, sleep, behave, and whatever else will happen. It needs to be on a continuous framework, and what we're trying to do then is to make care, the clinic, the home eventually in the future, with the whole system of IoT, which I'll talk about soon. So there's some other areas, but I'll talk about it as we go along. But these, in Frost & Sullivan, we believe these are the 9 big areas which are going to help to reduce cost, improve access, and improve outcomes. So what are some of the challenges that healthcare stakeholders face in this world today? So if you are a hospital or a healthcare provider, you're going to definitely see shrinking reimbursement as time goes. It's getting tighter and tighter and tighter. You're going to see lower margins. More and more generics are going to come into play, even in this region of the world where right now only 20% of the market is generics. We expect over the next 10 years it will become a 50-50 market. Who would have thought that in Japan, that was almost 10% was only generics. In 5 years, that market is 95%. So Japan could do it, every other country of the world is following suit. Providers are also going to face a lot of changes in terms of investments in healthcare IT. We're going to see a huge transition in terms of digitizing electronic medical records, clinical efficiencies, workflows, all the billings, claims. There's so much of work happening. But also with all of that digitization, there's lack of interoperability that is coming in. What that really means is no one is talking to each other. It's all working in silos. I have 3 problems in my body. Every body part is treated by a different doctor. No one talks to me as a holistic level. I have to be the one talking about my experience from one doctor to another doctor and sharing that. So that is going to really, really impact the system further. We're also looking at payers that are having a very, very strong role today in the whole reimbursement system. They need to also be part of the system of building the IT and the analytics. They need to also be starting to look at how they can reduce their cost, which means they need to start focusing on wellness. Today, every single US payer, whether it's Aetna, Cigna, Blue Cross, etc., has started very, very strong incentives and wellness programs in the United States. And that they're doing that specifically because they want to be able to reduce their cost structure over a longer term and keep people well and outside the hospital as long as possible. For pharma companies, the reality is the blockbuster era is over. We're really looking at specialty pharma, niche drugs, and a very different business model, and I'll talk about that later. The pharma companies need to make much earlier decisions in terms of licensing and drug development. They need to involve a lot of drug discovery that is going in using healthcare IT data, the genomics, the informatics, all of that. Precision medicine requires a lot of personalized data that goes beyond what is currently available. So a lot of challenges that big pharma companies are facing that they never thought that they would face over the last 5-10 years. So how is the whole paradigm of healthcare moving from what we saw in the last decade to this decade to the future? So the first, what I really see is that the last decade, 2000 to 2010, was really the decade, or even prior to that, was really the decade of a product-based sale, a brand-based sale. It was based on evidence. This is the evidence that this drug provides. This is what the ROI is. That is why you need to use it. There was a very little differentiation in terms of innovation. Really incremental innovation was most of the differentiation. It was never disruptive innovation. It was basically based on hardware, that is selling the product. And we were selling technology. Then today we have entered the whole space where we've really complicated the situation. We're talking about a value-based environment where we're selling based on value. We're selling based on results. We're not selling based on the cost of the product anymore. So however high the cost might be, if the outcome is not equivalent to the cost, and the cost and the benefit is not on the same page, then the question will be that who will buy the product. So an outcome-based model selling on value changes what you're actually measuring. Because really, what is value? How do you measure value? Those are the big questions we're asking ourselves when we sell MRI equipment, which is more than $1 billion today. The other thing that needs to happen is when you get into this model, really you're looking at how do you move from selling a product from a product-based company to a service-based company. And how do you build services around your product, which is really the hardware, the software, the platform around it. And the companies that are really good at doing that are not really healthcare companies. They are the Amazons and the Googles and the Facebooks who have invented the whole space of what service means. And so this is what we are grappling with today in terms of the center pillar. And then where we are going to go in the future. My vision of where we think healthcare will go in the future will really be medicine as a service. If you look at it, health as a service, wellness as a service. We're going to be focusing much more on prevention and prediction. We're also going to be looking at not just the hardware and the software, but also the intelligence that is derived from the hardware and the software, which will be able to give us the data and the insights to take action. So when I started, I talked about we want to move to a system where healthcare is invisible, where we don't have to make an appointment to call someone and have a discussion with a doctor, where we don't have to have something poked into our body to take blood, where it happens invisibly. When we go into the bathroom and we look at the Google mirror, it invisibly will tell us or communicate this information to our doctor's office that we're gaining weight and maybe being a heart failure patient that tells me that I'm having a lot of water retention and I need to go back to my hospital, as one example. Or by having a particular device which is attached to your home, you will be able to know other metrics that you need to know. So we need to come to a point where healthcare and care is invisible to us, where we are not taking the decisions to do it. And I think this is what in the future we're moving towards. I'm going to go on a little quickly because we have less time. Just a few slides on AI. So we've done a lot of studies on AI globally, and we've assessed the markets for AI globally by sector and what is the impact going to be by 2025. So obviously government is still a very small market for AI for healthcare. It's only $4 billion. The payer market is $8.3 billion. Clinician market, if you look at clinical decision support, precision care, cybersecurity, it's about $6 billion. MedTech, when we're looking at MedTech in terms of manufacturing, trials, $5 billion and $3.3 billion from the consumer market. So it's a fairly $21 billion market pretty much by 2025. Globally, there are over 200 companies in AI for healthcare. Why companies are doing AI differ by region. For example, in the United States, it's all about productivity and standardization. In the UK, it's about shortness, reduce the short times of waiting and the wait times. For China, for example, it's about access and expertise. If you look at medical imaging specifically for AI, which is the largest area that AI is going to be used and it's already being used, where the use cases are, obviously the top of the curve comes up with oncology and breast care. 34.8% of cases are being used for clinical application for artificial intelligence. And we have a lot of research on all of this. These are just top 10 numbers that I wanted to share with you. Let's talk quickly about the Internet of Medical Things. I mean, our previous speakers talked about products here and there, but I wanted to leave you a picture of what eventually the IoT field will look like on a total level. So what it will be simply looking at is a connected ecosystem of sensors, devices, wearables that are on the body. It could be in my home, it could be in the community, in the clinic, and in the hospital, that are all talking to each other, and where I am controlling through my cell phone my own data, and I'm owning that data. Now, obviously, you can say that this is like far away. It's in the next 50 years it won't happen, but many of these are already happening today. So if you actually look at it, every single one that we put on this list is actually taking place, but it's taking place in silos. So they're doing one-to-one, they're not doing one-to-many interactions. And what we're expecting to see in the next 5 years is that this interaction will get to one-to-many. And by 2025, I think many of us in many parts of the world will have a system to be able to do this. Estonia is one of the only countries in the world which has 100% EMR certified, and every single person has an electronic medical record that moves across all the systems. And they have been able to implement some portion of IOMT in the best possible way. We have some wonderful case histories of other countries doing it in smaller scale. But this is eventually what the model will look like when we talk about AMT, where the patient is at the center of the model. Just a quick factor on precision medicine. This is a very complicated slide, so if you can just bear with me, I'll go through the explanations. There are 4 quadrants in the slide, and what the purpose of this slide is really to tell you that the data today that we're using to make diagnostic decisions is going to be very little of that data used in the future. So if you look at slide 1 quadrant, 15% of that data is actually going to be used in the future coming out of that quadrant, which is what we do today, which is 100%. We look at an MRI exam, we look at a screening, we look at blood results, we look at vaccinations, we look at a doctor's consultation, and we make 100% of the decision of what we have. But that in the future will only be 15%. 20% of the data, quadrant 3, will be based on all the wearables coming in the future. So that makes it 35%, but the remaining 65% is actually going to come from areas which is right outside of healthcare. 40% of the data, 35% of the data is going to come from companies like Google, Facebook, that are already collecting socioeconomic information, social determinants of health, where you live, where you sleep, what you do, what you eat, what levels of stress you are in every single day, including your gender. And that is going to control the decision of what is going to happen to us. And another 30% of data is going to come from a lot of the genomics and the imaging and the informatics data, which is now work in progress. So as you can see, this is a very big change from how physicians will practice medicine in the future to how they've been practicing so far. And it makes a big change as well in terms of the onus and responsibility falling on patients to be able to do that. These are some of the companies we work with today that have very, very strong strategies. We call them the GAFA companies, Google, Apple, Facebook, Amazon, that have made very, very strong headway and changing the nature of what we talk about when we talk about platforms, cognitive intelligence, etc. One of the things I want to quickly end with is we're seeing a huge Amazonization in healthcare that has taken place. And this slide really gives you a picture of what Amazon's plans are in healthcare in the future in terms of what they plan to do, in terms of implementing care. So we have Alexa at the home that is going to be the primary giver of information when you have a cough or a cold or whatever. Alexa will help you then to identify the right doctor to see. You will be able to check prices of drugs or products on Amazon Marketplace, which is already being built, and with complete transparency anywhere over the world. From there, you will be able to use any service that will deliver your product based on doing an e-commerce transaction online. That will be sent to you through drones to your home, anytime, any place, and automatically refills will be set up, just like we buy any consumer products, and then you go back to your digital assistant to get advice of what the next steps are. So this is, in a very nutshell, a company like Amazon that is going to change the whole space of healthcare coming from outside with a very different mindset to where it is. Obviously, there's a lot of flaws in the system and questions, but this is currently what they are working on. Amazon is not the only company that's doing this. Alibaba from China has already implemented this program in many, many rural parts in the world. And they're using e-prescriptions, they're using Skype calls, and they have been able to achieve a 414% growth rate over the last year in implementing this in terms of e-commerce sales and consultation by doctors. So, in two different parts of the world, we're seeing very similar models in very different ecosystems emerging. I also wanted to quickly share the last model, which is a local model, a Kiwi here in the region that we studied, which is a telehealth company that's working in North Africa and Middle East. And it provides primary care services 24/7. And you can see how many people have already joined this system in terms of using the system, in terms of doctors joining it as well as patients joining it, and the number of calls that are happening. So while all of these rumblings are happening at the bottom level, we see so much of change that's really going to impact the top. So the challenges are tremendous, I can tell you. The first biggest challenge, I think, is cybersecurity and privacy. It's a very, very big challenge. Healthcare data operability is another huge challenge. The whole aspect of value-based care that we're going through globally is another big challenge. Who owns the data? And how do we, who has access to it? So these are all very, very big ethical questions as we're really changing the whole space and transforming it. So what I really want to leave you with is that for many, many years, medicine was really a clinical science, and we used data to support our medicine, but it was largely based on the physician and his experience and what he learned. But I think today we're looking at a reverse strategy. We're looking at data-driving medicine, data-driving diagnostics, and the physician really playing the role of attesting to that and helping that process along. It's not that the role of physicians will get less. I think physicians will be able to play the role that they're supposed to be playing, that is providing the empathy and the compassionate care and the feeling and the touch that needs to happen, that seems to have gone out of the healthcare system. And at the end of the day, I mean, in this industry, the difference that I say compared to a financial services industry and an automotive industry is that we need to be at 100%. Because if you're not at 100%, the error is someone else's life. And I think what artificial intelligence will do is, and we know time and time again, that they are much better than human beings at prediction, because it's an algorithm, and if it's set up the right way, it can give us the right results. So it will help us to get to the 100% accuracy that healthcare needs and become the service industry it needs to be. So thank you so much.